Well, good afternoon and welcome everyone to our Asbestos Awareness Week webinar. The title for this year is What's New for 2026? I'm Sharon Johnson and I'll be moderating this session with presentations from 6 leading Australian experts. Unfortunately, Nick Blackford will not be joining us today because of an urgent matter. However, fortunately, and to the generosity of Tracey, Bence has kindly agreed to speak during that time slot. Now, before we begin, I would like to start off with an acknowledgement of country. We acknowledge and pay respects to the past, present and future traditional custodians and elders of this nation and the continuation of the cultural, spiritual and education practices of Aboriginal and Torres Strait Islander people. Now, before I introduce our first speaker, may I request that you use the Q&A for questions during the session, and we will be addressing the questions at the end of our session, so we'll keep the questions all at once at the end. Also, the links for this webinar will be available on the AIOH and the AHCA websites. Now, our first speaker is Dr. June Sim, a consultant occupational health physician. Currently, June is the chair of the WorkCover WA Dust Diseases Medical Panel and also consults to the health and safety regulator WorkSafe WA. June has previously been the recipient of our New South Wales Dust Diseases Board Scholarship. The title of June's presentation is the WA Asbestos Experience. So I'm handing it over to you, June. Thank you.
So WA has unfortunately quite a tragic legacy with regards to asbestos and dust diseases. It started off in Wittenoom, where we were mining the blue asbestos or crucidolite. For those who don't know where Wittenoom is, it's about 1,400 kilometres north of Perth, and the closest port to Wittenoom is Point Sampson, which has its own significance. It was Pilbara's biggest town and it had its own bus service and airport, not dissimilar to what we currently have in a lot of our remote mine sites around WA and around Australia. But we're talking about the 1930s. There was no one working that town when it started, and there were brochures floating in continental Europe painting an idyllic sunny town to attract workers to Wittenoom. I would agree that it is sunny, but not always idyllic. The imported workers were often coming straight off the boat and then moving straight to Wittenoom, not necessarily even seeing other towns or cities on the way. Mining at the time in Wittenoom was a pick and shovel method. The underground mine was humid and poorly ventilated. Miners worked in a low stoop position, as you can see in the picture on your right. The mine was as low as 1 meter, and the mill was continuously producing asbestos and generating dust. Although you can see in the picture that the worker was wearing respiratory protective equipment, realistically, under those mine conditions, it was unlikely to be something that they were able to maintain, and likely something that was just used for photo opportunity. Following the mining of asbestos, it is then shipped to Point Sampson, which, as I said earlier, is about 330 kilometres from Wittenoom. It is shipped by trucks and then transported by ships to Fremantle and taken to the James Hardie manufacturing plant in Perth. Once it arrives at the plant, it is manufactured into various materials, including a lot of construction materials that we still have in our homes today. In addition to the construction industry, it was also used for asbestos lagging, but also in the transport industry on boats, trains, and other mechanical parts. All this was well and good from an economic perspective at the time, but asbestos-related diseases, as we know now, was brewing in the background. Asbestos affects 2 parts of the lung, broadly speaking. The pleura, which is the lining, and the lung itself. With the lining of the lung, it can cause pleural plaques, which is usually an indicator of asbestos deposits or exposure in an individual. It doesn't normally cause impairment of function. However, these plaques can coalesce and result in diffuse pleural fibrosis, which is the middle picture. This then constricts the lung and impacts on an individual's ability to breathe. And then it can cause cancer of the pleura, which is called mesothelioma. However, it did not only involve the lining of the lungs, but also the lining of the heart, the pericardium, and there's the peritoneal, which is in the abdomen. In the lung itself, it causes asbestosis, which is a fibrotic disease that affects the ability for the air transfer in the lung, and also lung cancers. And the risk of lung cancers would increase if someone is a smoker. This was not known until a Dr. Eric Saint, pictured on the left, a government medical officer, wrote to the head of the public health department in Western Australia. He was concerned about the dust levels at the Wittenoom mine and mill, and that there was a lack of extractors. He warned them of dangers of asbestos and the development of asbestosis. He said that the mine would produce the greatest crop of asbestosis in the world has ever seen. And unfortunately, his warning and predictions are true. He had also told Wittenoom mine management that asbestos is extremely dangerous and that men would contract chest diseases inside of 6 months. Over the following 3 years, the dust levels at the mine and mill was regularly monitored, and it was found to be 6 to 8 times safe levels. And those were levels at that time, which is a lot higher than the levels we have now. There were repeated warnings to mine management, but there were no improvements in the conditions. The mining continued in Wittenoom into 1966. In 1950s, the introduction of a dust allowance for those working in those areas, 5 cents an hour, they were given, and it was also introduced extraction systems and respirators. Between 1961 and 1966, there were 100 more lung cases in Wittenoom workers and ex-workers, more than any mine in Western Australia at the time. On the 21st of August 1966, the Colonial Mine, the largest mine in Wittenoom, became the last operating mine, and it closed due to economic conditions of mining. By that stage, the whole mine had produced 161,000 tons of crucidolite fibre. Despite the closure of the mine, the toll of Wittenoom continues to rise. It is believed that there is more than 1,200 deaths related to asbestos-related diseases from Wittenoom. However, the impact of Wittenoom was beyond the workers there. It affected the residents and those who provided services to the town. There were activities in the town, as you can see in these pictures, involving exposure to asbestos and exposing vulnerable populations, such as the children in the town. In November 1978, the government announced the closure of Wittenoom based on appraisal of worldwide information on the harmful effects of airborne blue asbestos fibres. In January 1989, the first successful common law claim for mesothelioma from a past Wittenoom town resident who lived there as a child. Asbestos became an Australia-wide ban on the manufacture and use of all types of asbestos containing materials from the 31st of December 2003. By that stage, The Whittingham toll was over 500. James Hardie was accountable for its failure to acknowledge the damage to workers' health and obligations to compensate workers affected for asbestos-related disease. They later established a medical research and compensation foundation. Despite the closure of town, there is still tourism in the area. The government turned off the power grid to Whittingham on the 30th of June 2006. And you can understand from those pictures there that it is social media worthy on the left photo, despite the warning signs that have been posted around the area. But you can see on the far right photos that it is adjacent to Karijini National Park. And those of you who have been there before, it is a very beautiful part of Western Australia. In March 2002, the Whittingham Closure Act 2002 was passed, and decontamination of the area started in mid-2003. There was extensive use of different contractors to decontaminate the area. But despite that, you can see in the photos on the far left that the tourists are still trying to get into that area to visit that area. So what does this all mean? And what does the future look? The unfortunate reality is that those predictions by Dr. Eric Saint and what we know now from the mining, milling, and exposure of asbestos has resulted in dust disease claim. From the work cover WA data, which is only based on workers who have worked with asbestos, not necessarily the residents of Whittingham, is that the number of asbestos-related diseases has plateaued off but has not ceased. It peaked in the 1980s, but there continues to be significant numbers in the 1990s. Between 2018 and 2024, we have over 120 asbestos-related disease claims, as you can see in this chart. We still have cases of mesothelioma and asbestosis, as well as diffuse pleural fibrosis. And we know that because of the latency period of developing the disease, the average age of claim is in the 70s. So from the past, we do need to look into the future. And I know that our other speakers will be speaking on some of these topics, highlight some of the issues and challenges that we have. We still have asbestos-containing material, construction material, in a lot of our homes and properties. And this will continue to challenge us. Although it is fairly stable, it can degrade and disintegrate with time. Despite the closure of Whittingham, there is proximity to that area, and we do have our Aboriginal population who has connection to the land. And by blocking that area, it does not necessarily mitigate the issues and their exposures when they go out bush and reconnect with their land. We still have the children of Whittingham who are elderly adults now, and as a general population, we're all living longer, and they will continue to pose as cases for us. And finally, in the media recently, we are going to see the importation of asbestos inadvertently in some products, and recently with the decorative sand that the children were playing in. So it is important as a population that we are mindful that asbestos is still present around us, and that those challenges needs continuous awareness and monitoring.
Okay. Now, thank you, June. Now, you have to jump off because of another prior commitment. So you won't be at the end of our webinar. So I am going to open it up just for a short time. If anyone's got some questions, for June, if you don't mind, if we just give you a couple of minutes, because I mean, that was a fabulous presentation. I really appreciated you going back to the history of Whitnam, because it reminded me when I was a young hygienist when a lot of that was going on. But can I raise a question myself? Asbestos isn't banned in all countries, hence the problem that we have with the asbestos in sand issue. Are you in a position to comment about how materials can come into Australia and not be tested, or at least have a certificate to say that they have been tested and found to have no asbestos, particularly when people are bringing in from countries like China, etc., where we know that asbestos is not banned? It's probably a bit of a tough question for you, but do you have any comments on that, or insights into how we can try and prevent these situations happening again, like the asbestos in sand for the children?
Yeah. Look, I don't, to be frank, I don't know the answer to that question, because it obviously involves various agencies, quarantine, the government, like economic reasons that they allow importation of various things, but also we know that some countries that still produce asbestos may not have a stringent testing regime anyway as well. Mm-hmm. I think that for us, if the people that import or utilize those things randomly test for it, then our awareness continues. And yeah, because we do that in a workplace setting. Like, we have had examples where, brake caskets are imported and it's just randomly tested, and then we find out that, hang on, this product contains asbestos. But I think it has to be a multifaceted approach and not just relying on the border control.
That's fair. I mean, in all fairness, under the Health and Safety Act in every state, a supplier has a duty of care to know what's in his product and write an appropriate safety data sheet, and to alert users of that material, whether it be the general population or whether it be workers who might be repackaging these materials, or teachers in schools, for example. But all suppliers have a duty of care, which some suppliers are not so good as others.
No.
I was actually going to just make a comment too, that that is an amazing story about Whitnam, and I remember reading there's books about the workers at Whitnam at that mine. It is such a tragedy that I think, and you'd be able to comment on this one, that was often the conditions were so bad, like they would go down to the wharves, and when people were coming in after the war years and looking for work in WA, they were always selected the strongest, a lot of Italians and Mediterranean people who would come in, and they'd give them this opportunity to go up there, and they'd had all this accommodation paid for, except they find their salary paid for all the food and accommodation living at the mine site. And then it was so bad, the conditions, that the miners would leave, and the only people who stayed the longest were the managers. And so therefore they actually had also quite a longer period of exposure of asbestos. Have you found that in your the work that you've done with asbestos and the current people who are suffering from mesos and asbestosis?
Well, what we do see is, we don't see many people that have worked in the mines, because the people that had worked there are now in their late 80s to early 90s. So, so I think I came into the occupational medicine scene most probably towards the tail end of that population. What we do see now is the support workers and the children. So, not support workers of the mines, but the workers who have worked with the construction and the asbestos containing materials. Yeah.
Okay, then. Good. Well, thank you. June, I'm going to close it there. We don't have any more questions in the chat, but I've certainly enjoyed it. Thank you so much. It was an excellent presentation, and great to go back and remind us of what happened in those years gone by, that we should never forget about the Whitnam experience. Unfortunately, Australia led the world in that way, but I'm so pleased that we led the world in banning it in 2003. So, and we're doing so much good work now. So thank you, June.
You're welcome. Thanks.
Okay, our next speaker, I'm very pleased to present very dear friend Tracey Bence. Can't resist Tracey. Tracey is currently an expert member of the WA Occupational Safety and Health Commission. She's a past president of the Australian Institute of Occupational Hygienists, and she's done many things. I know that they're not mentioned here. She has had a varied career and is quite incredible, Tracey. I was quite amazed the number of industries you've worked in: offshore gas, oil and refining, mining, construction, and remediation. So you've had a wealth of experience of all sorts of exposures in that case. So Tracey's paper is titled, Well, 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 What Do We Do Now?
This evening I'll be speaking broadly about workplace exposure prevention, but specifically about workplace exposure limits. And let me say at the outset that there's a very, very important role that workplace exposure limits play. And so through the lens of a change in workplace exposures generally, let me share with you my thoughts. What do we do now? Yeah, as Sharon said, I'm kind of in love with occupational hygiene. Sharon, please just confirm that's moving on to the slide with the pic.
Yes, that's fine, Tracey. Thank you.
Perfect. So I'll cover these workplace exposure limits that become effective as of 1st of December next year. I'll explain why I think that it's far more significant than a name change. And I'll talk through some specific examples, but nevertheless, there are hundreds of new and lowered workplace exposure limits. The asbestos workplace exposure limit is not changing. It is staying at the values that you probably know now. So importantly, when we have changes in workplace exposure limits, they're intended to provide a catalyst for change. So what do we do now? So the important things that are coming along is guidance as regards to how to work with these new workplace exposure limits. But I'll share with you my tips. It's a great time between now and the 1st of December 2026 to refresh your knowledge on sampling and analytical error. And the reason I say that is these lowered numbers, where our precision is going to need to improve and our uncertainty is going to need to be less. We are going to need to limit our uncertainty. And I think those of you who are talking to workers, talking to persons in control of businesses or undertakings are probably giving a lot of advice. And then my suggestion to you is you be clear about when exposures are acceptable and not, taking into account both the consequence, which in the case of asbestos is mostly irreversible, but also the likelihood, and stick to the principles of so far as is reasonably practicable. So yes, there were 401 days, but now there's only 399 days before the workplace exposure limits replace what was known as the workplace exposure standards. As a hundreds, more than 300 are going to change on the same day. So what's so different other than the number? Because occupational exposure limits are typically time-weighted, and these terminologies, time-weighted average, perhaps threshold limit values, perhaps short-term exposure limits you've heard of, or peak, these terms will still be used. But what's the difference between the WES and the WEL? So I describe it as same, but significantly different. So our current WESs are intended to be protective of most in a working population. Sometimes they were devised years or decades ago, but they've never been considered a fine line or a dividing line between safe and unsafe. And yet we use these numerical values all the time. They're almost used like a ruler or a measure. But when you're working on what's protective of most, it's important to know that even our current WESs do not offer absolute protection for all. And they do not offer a point at which something necessarily becomes unsafe or the health risk becomes unacceptable. They're based on this epidemiology. And this model is where you see disease incidence and then you calculate the exposures associated with that disease incident and essentially regress back to a lowered value, which is protective, and that becomes the occupational exposure limit. That's how we work now. And these OELs are used as legal limits, and they're usually put into legislation, either sector-specific legislation or the model work health and safety regulations. The trick is that we're in a period now where these legal limits, these WESs, have rarely been tested by litigation. That may be a good thing, but I think it's relevant to the discussion about what will change when we move to workplace exposure limits, because the intention of the name change by the Work Health and Safety Ministers unanimously in 2019 was to make it clear that the new WEL or these limits are not to be exceeded. So they are an upper limit. The WELs use various bases to determine their recommended value, and then Safe Work Australia members voted on those values. So the technical work behind that was then subsequently agreed by the Safe Work Australia members, and most of them have been published. Sometimes these new values are very low and close to the limit of detection because they have been premised on the no observable adverse effect concentration. Example of that is NO2. Or sometimes they're based almost entirely on animal studies. So there are many substantive reductions from the WELs. And as I said, some are very low numbers that we've never seen before. There is a table, and so I would refer you to the Safe Work Australia for this comparison table. You go into your Safe Work Australia site and you can search Airborne Contaminant Hub for this comparison table. But on screen, you can just quickly see that, say, in the example of acetone, we are moving from a TWA of 500 to a TWA of 250. Say the example of acrylic acid, the number's actually coming up. And if you look at acetic anhydride, we have new values, TWAs and STELs as one part. They're in parts per million, those values. But the table is several hundred rows. So there's still some to be decided, and they're 9. We've just come to call them the 9 workplace exposure limits for chemicals yet to be decided. Some of them are fairly significant. Their impact is considered to be fairly significant to the Australian economy, and for that reason they're going through additional impact assessment. So relevant to today's discussion is the fact that the asbestos WES is not changing, and the respirable crystalline silica WEL, or at least more precisely, the 4 different values for respirable crystalline silica polymorphs, they have still yet to be determined, along with the chemicals that are probably well known to yourselves on the left-hand side of this page. So as I mentioned, down the bottom, you'll see the old WES chart that is still on the Safe Work Australia website, and it remains current until such time as the this whole chart remains current until the 1st of December 2026. And the asbestos time-weighted average is there in 0.1 fibre per mil, unchanged. But for all the others, now what do? Hundreds of them, all changing on the one day. You can only just imagine how busy we're going to be on the 1st of December 2026. So right now, there is still an obligation to keep exposures below the exposure standard in all states and territories of Australia and all sectors. But going forward, yeah, workplace exposure limits. So my last few slides are just around what I think would be the right practice for us as health professionals, as experts in asbestos, or as those who want to promote asbestos, protection from asbestos and other chemicals in Asbestos Awareness Week. So it's important to make recommendations, if you're in that capacity, to duty holders that they actually are required to do more than meet the magic number. They must do what is reasonably able to do in the circumstances of a reasonable person. And the Safe Work Australia guidance, from where I got this language, talks about erring on the side of caution. The greater the degree of harm, the more requirement to eliminate or minimise the exposure. And if there is even a moderate likelihood of death or serious illness, the highest level of protection is to be provided. And this is from Safe Work Australia. Many of you will potentially consult or be working for businesses of all different sizes, and cost is important to you and to them. Costs can be taken into account, but weighing up savings, there's a couple of cautionary notes in the Safe Work Australia guidance. Controls selected simply because they are cheaper are unlikely to be considered so far as is reasonably practicable. And conversely, cost that is grossly disproportionate to the risk may be considered not reasonably practicable. But sometimes you don't even have to do all that. Sometimes you can literally look at it and determine that there is exposure in this scenario that doesn't need to be there. And so my message to you today, if you have the opportunity, be clear about what exposure is acceptable or not. And sometimes you may be able to do that without monitoring. Also look around for control options that demonstrate so far as is reasonably practicable. This picture is absolutely my favourite. It is about operator enclosures. I can think of no safer place for the workers that I care about to be in a pressurised and filtered operator enclosure for protection of silica or asbestos. And what can we do while we're waiting magically for the 1st of December 2026? I would encourage you to refresh your knowledge of sampling and analytical uncertainty. So what you have here is a diagram, like a fishbone diagram, cause and effect diagram illustrating sources of uncertainty, sampling, the calibration, the instrument variation, recovery, sample loss, what happens in the transport, what happens when you lose flow rate, when you lose deposition. All of these provide opportunities for uncertainty. So in your own practices, I've found it a great time for me to refresh on attention to this data. And when I'm talking about uncertainty, it's a whole raft of things. It could be total uncertainty, meaning just the doubt about the validity and the precision of the result. Could be absolute error, particularly those who deal with lots and lots and lots of results. It could be around the limit of detection. That and a limit of detection definition is the lowest amount of an analyte in a sample that can be detected but not necessarily quantified. And we often see this as micrograms if it's a gravimetric weight on a filter. And limit of reporting will be specific to the analytical method. So we have guidance from OSHA that says if you're thinking of your samples in the construct of compliance, then best practice would be that the combined sampling and analysis error should not exceed plus or minus 25% at the 95th confidence level. So for very, very low numbers and very short sampling periods, that will provide a challenge. On other attention to detail matters, this one's come to my attention a lot lately. The diesel particulate matter workplace exposure limit is coming in for workplaces all around the country that never previously had this exposure standard protection. So this is an example of the NIOSH method. It states its overall precision is around 16.7 plus or minus. So when you're looking at very low numbers, and the DPM well has been published as 10 micrograms per metre cubed, then this level of precision requires significant effort and potentially more improvements in the methods, both sampling and analytical. Also would counsel you, don't forget to wrap me up, Sharon, when you're sick of me. Also would counsel you to look at your limitation statements on your laboratory providers. This one is not about asbestos or about silica, but it's pointing to a lack of data from the client on the pressure and the temperature for the sample. So if there's a possibility of closing those types of gaps, now's the time to do it.
Right.
And yeah.
You have about 2 minutes to go, Tracey.
Perfect. This one is probably near and dear to a lot of you, polarized light microscopy, and it's a limitation or a statement from the analytical report, warning that this is a qualitative technique and warning that there are some types of asbestos that do not respond or are not detectable by this method. It's particularly pertinent to those who work in and around naturally occurring asbestos and substances like asbestos types like actinolite or tremolite. So respirable dust. Here I'm promoting the AIOH paper on minimising uncertainties when sampling and analysing respirable crystalline silica. We may be grabbing our trusty cyclone, but there will be intervariation and between cyclone variation in the performance of those cyclones at numbers that may surprise you, 27%. So another one to look into. I'm wrapping up now, but I'm reminded of why we do what we do. And I thank June for presenting the latest Western Australia work cover data around asbestos-related diseases, more than 120. This data on screen is from our brand new National Occupational Respiratory Disease Registry. So it does, at this point in time, this data, up until May this year, excludes Queensland. But we are now tracking in a non-compensation database dust-related disease, including those from asbestos and silica. And this has been an important move as a result of the dust disease national strategy. But we know workers' compensation and occupational respiratory disease data sets are unlikely to estimate the human or the numerical impacts of past exposure. And so I would like to finish by just reinforcing that the precautionary approach is still in fashion and it's still very important where the consequences are irreversible and the outcomes are cancer and other lung disease. Short plug for helpful AIOH resources with some papers here. For example, how do I measure silica in my materials? What's the most effective controls? What do I need to know about air monitoring? How do I find someone for air monitoring for silica? And then a few videos. They're only about 1.5 minutes long on asbestos, silica, and some tips for general exposure assessment if you're new to that field. And finally, here's an easy way to access those things if you would like to use your phones to scan the QR code. Thank you, Sharon.
Good. Well, thank you, Tracey. Thank you. It's quite concerning, isn't it, when going to these lower values and the issues around the instrumentation that we're going to use to try and measure it. It opens up a Pandora's box. But anyway, please, would people keep their, put some questions into the Q&A and keep them for Tracey at the end, because I know there's quite a few that come to mind for me when talking about the practicalities of trying to measure people's exposure in the future with very low exposure standards. Might add, remember the Russians when we were growing up always had the very lowest exposure standards, but no one measured them because they couldn't be measured, but they weren't protecting people's health. Thank you, Tracey. Our next presenter is Dr. Georgia Khatib, currently the Senior Lead for the Strategy, Policy and Specialist Advice Team with the National Asbestos and Silica Safety and Eradication Agency. Georgia has more than 10 years policy and regulatory research experience in the Australian public sector. Georgia has a PhD in medicine and a previous 15-year career as a biomedical research scientist, both nationally and internationally, in academia and pharmaceutical industry. Very impressive, Georgia. The title of Georgia's paper is The Asbestos 230 Blueprint, Advancing Proactive Asbestos Removal. Thank you, Georgia.
All right, so thanks for having me today. I'm here representing the Australian Government Asbestos and Silica Safety and Eradication Agency, and I wanted to share with you how we've gotten to our position for the need to advance proactive asbestos removal in the built environment. So firstly, a little bit about the agency. So the Asbestos and Silica Safety and Eradication Agency was first formed in 2013, and this was following a whole of Australian government review. And our role at the time was to coordinate national actions to eliminate asbestos-related diseases. In late 2023, our functions were expanded to coordinate national actions to eliminate silica-related diseases also. This occurs through different undertakings for both asbestos and silica in terms of supporting and monitoring the implementation of asbestos and silica national strategic plans, fostering collaboration between relevant stakeholders nationally and internationally, raising awareness using consistent messages, policies and practices, conducting and promoting research, collecting and analysing data to measure progress against the strategic plans, as well as to inform evidence-based policies and strategies, and as well as administering the import and export permissions for asbestos and more recently engineered stone. So in relation to the Asbestos National Strategic Plan, this is currently in its third phase, covering 2024 to 2030, and it is ambitious. As I mentioned, it is focused on proactive asbestos removal. So with this strategic plan, our role is to coordinate priorities and strategic actions, as well as lead some of those actions ourselves as an agency. And in undertaking this coordination role, we ensure that all levels of government are working towards a shared purpose as outlined in the strategic plan. We bring government agencies together within each jurisdictions to ensure that agencies' actions are indeed coordinated and to share our very limited resources and use them as wisely as possible. So to inform the development of the third phase Asbestos National Strategic Plan, in 2023, we undertook a socio-economic evaluation of asbestos management and removal options. We did this to determine what feasible and cost-effective strategies could be implemented by governments to increase the rate of safe, proactive asbestos removal, and in doing so, contribute to work towards the elimination of asbestos-related diseases. So this slide here just is a summary of the key findings, and we had three options that we modelled. So the baseline or the status quo, option 2, which was an improved regulatory framework. So this included a mixture of non-legislative and legislative measures under work health safety and other asbestos related frameworks, and these were spanning the entire asbestos life cycle from identification all the way to removal and disposal, and included other things such as education, compliance and enforcement. Option 3 in our evaluation built on option 2. So I included everything that was part of option 2, but also had government incentives laid on top to further increase the rate of safe removal of asbestos from commercial and residential properties. So you can see from this table, for option 1, we didn't quantify the costs associated with the status quo. So what you're seeing for options 2 and 3 are the additional costs in the first row and benefits that arise from the changes that were proposed. So in the status quo, the current baseline model, all in model ACMs were to be removed by the year 2100. Now, if we were to improve the regulatory framework, we would remove those same volume of ACMs by 2073. And if we laid incentives on top of an improved regulatory framework, those same volumes of ACMs would be removed by the year 2068. Overall, taking into consideration the costs and the benefits that were identified with the options that we proposed, we were able to determine that for every dollar invested in undertaking the actions outlined in option 2 or option 3, there would be a return on investment of around $2 to $3. So a lot of the benefits were not quantifiable. And these are listed here. And there are also some other qualitative costs that we were unable to quantify. So with the addition of these costs and benefits, these figures here, if they were quantifiable, would be amplified, and so the return on investment would be greater. Overall, options 2 and 3 also lead to an additional up to 28,000 lives saved over the modelling timeframe. But given the latency of disease onset from exposure to the start of when asbestos-related diseases are typically diagnosed, the benefits would carry on beyond the year 2100 as we had modelled in this evaluation. So overall, what we're seeing here are clear economic and social benefits from increasing asbestos removal rates, either through an improved regulatory framework alone or an improved regulatory framework in combination with government incentives. And this evaluation provided the solid evidence base for the strategic actions that were included in the Phase 3 Asbestos National Strategic Plan. For those interested in reading the full report, there's a link available here, and I understand the slides will be made available after this presentation, so you can access that. If the link isn't working, please jump onto the ASSEA website to find the report. The government incentives that were included and costed in the socioeconomic evaluation are the top 4 that are listed here. So things like subsidised removal activities, tax offsets, variations of different types of loans, as well as grants and rebates. So these were identified in research that was being undertaken concurrently with the socioeconomic evaluation, but ultimately in that research we identified 5 different categories of government-supported incentives that had been used in Australia or internationally for proactive asbestos removal, and in the research, again, which is accessible via the links at the bottom here, you can find more details on this. Now, the purpose of this research wasn't just to identify incentive types that could be used. It was actually to assist governments develop incentive programs as part of their implementation of the ANSP, or to leverage existing programs that would encourage proactive asbestos removal. The report and what we have proposed in terms of these incentives would all be subject to governments undertaking their own risk assessments and stakeholder consultation, as well as cost-benefit analysis, but that baseline research that allows them to make a start in this space is covered. The spectrum of the options that we have identified, we believe acknowledges that jurisdictions will be at different states of readiness to resource and implement such programs. But overall, there's feasibility in what's been presented. This research, as part of this research, we also partnered with the behavioural economics team at the Australian government to try and work out which of these financial incentives would be most preferred by Australian homeowners, in particular, to proactively remove asbestos from their properties. Unsurprisingly, grants and rebates were the preferred option, and as I noted earlier, these top 4 incentives have been costed in the socioeconomic evaluation, and therefore the Asbestos National Strategic Plan actions are feasible and implementable as they stand. So additional information you can find in these reports includes guidance on how to determine appropriate policy objectives and prerequisites for implementing an incentive program, measures of success, as well as risk management measures that need to be considered. There's program design checklists and program funding options to explore in terms of financing these incentives outside of availability of funding internally. Again, please access these links at the bottom of this slide for additional information on the ASSEA options report, as well as the additional research with the BETA team. To further all this work, we're continuing to examine all the elements that are required to support this increased rate of removal. So we're not stopping at the socioeconomic evaluation, nor what's been captured in the Asbestos National Strategic Plan. We are developing what we've called the Asbestos 2030 Blueprint, which will define the pathway for us to increase the rate of asbestos removal in a manner where the risks are effectively controlled at each stage of the asbestos journey. The objectives of this work, and ultimately we see it as a way of informing our forward policy agenda. But what we want to do is identify and address any gaps and areas that are not working effectively, and these can be considered for inclusion either in the current Asbestos National Strategic Plan, for example, after the midterm review, or they can be taken up in the next phase Asbestos National Strategic Plan. We're also looking to identify proactive asbestos removal programs that are currently in place, how they've been used in different scenarios, what are the lessons learnt from each of these, and use these as sort of future guides for implementation in a broader sense. We're also looking to identify and compare different cost models that are applied across the asbestos journey to work out if those what the actual costs are for planning for proactive asbestos removal. This work is being undertaken in 3 stages. We're currently in the initial exploration phase, where we're looking at the existing evidence base that's already defined in the ANSP, as well as knowledge of other work that's currently underway or being planned. Lots of desktop review and information gathering from our interactions with stakeholders, as well as reports and other things that we come across. The next step will be to undertake targeted workshops and engage industry unions, regulators and other stakeholders to get a much more detailed understanding of any remaining issues that need to be addressed. And finally, we'll pick up specific issues into discrete issues paper and define what the issue is and what strategic actions can be applied to optimally support or continue supporting a safe increased rate of asbestos removal. This is literally the mechanics of where we're at. So we have a document where we're looking at what is needed for effective asbestos, an effective asbestos system from end to end. defining what is already in place, what policy processes, practices are already underway, if there are any gaps or if there are issues where things are not working effectively, and defining what potential solutions exist. So what these are, who's doing them, and when they're being undertaken. This is happening across the asbestos life cycle, and where we're at right now is we've mapped all the ANSP issues and actions, as well as additional insights from our committees and progress reports. And what we're hoping to do today is seek additional inputs from audience members here. So if you have any insights to share aligned with the strategic actions in the ANSP that point to further needs or gaps or opportunities or examples of better practice or costs, anything that can support increasing the rate of asbestos removal, please reach out to us, please email us, please share this knowledge with us, because that will help us formulate positions that we can consult on to determine how we can take these matters forward. Ultimately, what we want to achieve is that in 2030, we'll have a clear approach for risk-based proactive asbestos removal that is safe, feasible and accepted, because we have a regulatory framework and incentives in place to support this. We've learned what works and what doesn't work when undertaking a proactive removal project. The end-to-end asbestos system is working effectively, and this includes things like industry capacity and capability, and governments have committed resources to this approach. The document is continually being updated as we identify issues, and this will be a constant living document. We believe this work will support the Safe Work Australia Model Work Health Safety review, as well as the asbestos framework review that is in the pipeline. And the first formal stakeholder workshops are planned as part of the Asbestos 2026 conference. So I'll leave it there, and thank you, and I look forward to questions at the end of the webinar.
Right. Well, thank you, Georgia. First, can I just say thank you very much. That was a really interesting presentation, particularly when we started with June talking about 1940 when we were mining the asbestos at Wittenoom, and here we are 80 years later now preparing programs on how to remove it safely and remove it completely. So really interesting life cycle of a product. So thank you. Could I encourage people to put questions into the Q&A so we could address them later with Georgia? Okay. Now our next speaker, our fourth speaker is Mr. John Batty, who is currently the Managing Director of EDP Consultants. John has 20 years experience in asbestos and hazardous materials management in Australia and internationally. He's a member of the Asbestos Education Committee and the National Asbestos Awareness Campaign, and a former president of the Asbestos and Hazardous Materials Consultants Association, AHCA. John's paper is titled Balancing Risk and Heritage, Managing Asbestos in Historic Structures. Thank you, John.
Thank you, Sharon. It's great to see so many people here today. I guess, it's Asbestos Awareness Week. It's great that we can get so many people here online to listen to these presentations from such amazing people. And a big shout out to Sharon Johnson as well, who without Sharon, we wouldn't be able to have this today. So thank you, Sharon. Just want to talk about, I guess, balancing risk and heritage, managing asbestos in historic structures. I'll probably caveat it by saying I'm not a heritage consultant. I do manage asbestos a fair bit, but we've done a fair bit in this space of late. I probably want to share what the reasoning behind this. First of all, just go through quickly what we're going to be talking about. So really getting an understanding of what the asbestos risk is associated with heritage context. We need to understand that the prohibition came into effect in 2003, and a lot of these asbestos products were installed. We had that love affair with asbestos, and in Australia, really between the 50s and 70s, we had a huge amount of asbestos going into buildings, and a lot of these buildings can be classified as heritage buildings or culturally significant, and there's something that we need to be aware of. Also explored the Borough Charter and the principles around that. And the Borough Charter really is that framework that's been put in place to conserve places of cultural significance. Learn management strategies, review compliance obligations, and then we'll discuss some case studies as well, some work projects that I've been working on myself in the past. So first of all, why is asbestos relevant in heritage buildings? We need to understand that asbestos was commonly used in building material all the way up to the 1990s, and we know that the prohibition came into effect on the 31st of December 2003. There's been over 3,000 materials that have been identified to contain some form of asbestos, and that number seems to be increasing of late anyway. But ultimately, a lot of these older structures may have cultural significance and may also have asbestos. And we need to understand what are our responsibilities around that? How can we manage the risk associated with asbestos, as well as, maintaining that cultural significance of those buildings? The Borough Charter was updated in 2013, but ultimately provides a framework for conserving places of cultural significance. And how does this relate to hazardous materials like asbestos? So firstly, the Charter looks at cultural significance and fabric. So the Charter defines fabric as all physical materials of the place, including components and fixtures. So asbestos-containing materials are part of this fabric, and if they're integral to the original construction. Conservation decisions must respect the cultural significance of the place, which means asbestos cannot simply be removed without considering its heritage value and the impact of the authenticity of the material on the building itself. Secondly, we need to look at the conservation principles as well. So Article 3 notes that the conservation should involve the least possible physical intervention and avoid distorting evidence provided by the fabric. So that means asbestos removal should really only occur in heritage, culturally significant buildings, if necessary for safety, and ultimately should be documented. That means we ultimately need to have management strategies in place. So if we can't remove the asbestos, because it is culturally significant, and being an asbestos consultant, our aim is to reduce the risk to occupants and reduce the risk to builders. We can do that by eliminating the hazard, obviously, but if we can't do that, we need to manage the risk. And we do that through risk assessments, developing registers, and also developing asbestos management plans. And ultimately, those asbestos management plans really should look at the building fabric and the heritage and the cultural significance of that building fabric. We can look at encapsulating and sealing, which is obviously the preferred option over removal in these sites, and remove only when necessary. Obviously, if there's a situation where the material is degraded significantly and really is a risk to occupants, that should be removed and replaced with something that appears to be the same. And ultimately, we need to develop detailed documentation of that intervention so that can be recorded into the future. So compliance obligations. So we're still bound by the work health and safety regulations, be that in the state or territory that we work in. If we are doing any removal, we need to engage a licensed asbestos removalist. There are those requirements around notification and clearance requirements, and then development of that asbestos management plan. We always recommend that those asbestos management plans for culturally significant buildings be done in alignment with the heritage impact assessment of that site as well, and then align our legal compliance with our heritage conservation. Everyone loves a few case studies, and we've got a few case studies here that we can talk about. So here we are. This is one of the New South Wales train stations. Lovely old brick buildings that were established. These are culturally significant, and the aim really is to maintain that cultural significance and the look and feel of those buildings. In this situation here, the decision was made to actually remove the asbestos cement awning that was across that site. But ultimately, the decision was made that the awning would be removed to ensure that the hazard or we would be able to eliminate the asbestos hazard. But then ultimately the awning was replaced with a new non-asbestos fibre cement sheet. Where they used to have the old asbestos cover strips, they were replaced with timber cover strips that looked the same, and then ultimately painted in the same colour. So we were still able to maintain the cultural significance and the heritage aspects of the building with the look, while removing the hazard. On another example, there was an aircraft hangar that had Commonwealth Heritage, that was Commonwealth Heritage listed. In this hangar, asbestos was identified in the form of putty to the windows. Now, those windows were heritage and culturally significant. The windows ultimately needed to be repaired, and the putty was at a position where it was starting to flake and fall away from the window itself. So the decision was made to ultimately repair the windows under control conditions to ensure that the putty could be removed, or the flaking and damaged putty could be removed, the damaged windows could be removed, all under controlled asbestos conditions, and then the windows would be stabilised, the putty would be stabilised with the new Sikaflex product. And that was all done in consultation with the heritage consultant to ensure that we were able to maintain the heritage aspects of that building while ensuring that we had a safe workplace for people after the fact. And the final example we have is a site up north in Queensland, the Double Island Point Light Station. Now, that light station had state heritage listed. Asbestos was identified not so much in the lighthouse, but in the satellite buildings on site. The national parks there would allow people to come onto the site and man the station for a period of time. And as part of that, they were required to undertake some maintenance. They knew that they had an asbestos risk on site, but couldn't remove that asbestos risk because of the cultural significance. So the decision was made in consultation with a heritage consultant that an asbestos and heritage consultant could come out on site, determine and develop an asbestos treatment plan on site. And that ultimately allowed us to, I guess, evaluate the management strategies for that site, put in recommendations to stabilise material to the point where if people need to come through and undertake maintenance, they had the asbestos management plan present with them so they could do it safely with a little bit of training and ensure, one, they maintain their health and safety during any of that work, and two, maintain the heritage significance of those sites as well. So I guess the take-home message really is that in some situations, if the site is culturally significant, we don't need to go through and remove all the asbestos as we would in other sites. We can manage it in situ. We need to be aware of the cultural significance. We need to engage with our heritage consultants. We have our borough charter there, which guides the minimal respectful intervention requirements that need to be put in place. Safety and compliance cannot be compromised, obviously. We need to document everything for future interpretation. And then finally, hazardous materials and heritage consultants really need to be working together to find a solution where safety, or the risk from safety, and the cultural significance of these sites can be maintained throughout the life of the building going into the future.
Thank you, John. That's excellent. There's some interesting examples there, so thank you very much. Again, any questions for John, would you please put them in the Q&A and we'll address them later. Okay, our final pair of speakers, Jackii and Brian from FAMANZ. Welcome. Now, let me give you an introduction. I don't think these people do need an introduction. They're so well known in the industry, but it's great to have you with us. Jackii Shepherd is currently the Secretary of FAMANZ and has a broad experience in workplace health and safety, hazardous chemicals, asbestos, and exposure assessment policy and operations. She's worked both in the private and public sectors at local and national levels of government. And Brian, I don't really think you need an introduction, Brian. You've been part of the asbestos then for such a long time. Brian's currently the chairperson for FAMANZ and has extensive consultancy experience in the fields of environmental and workplace safety, asbestos safety risk assessments within the Australasian region. The title of their presentation is Australian Asbestos Competency 2026. Thank you.
Cheers, thanks, Sharon. As you said, my name's Brian Eva. I am chair of the faculty, and I am joined by my dear colleague Jackii for our talk today. And I'm going to hand straight over to Jackii for the first part of our talk.
Thank you, Brian. So today we're going to talk about asbestos competency and why asbestos competency must be a national priority in 2026. Why the system may not be working as it is intended right now, and what FAMANZ and our wonderful partners are actually going to be doing about it. So what is it? For years and years and years, the asbestos industry has been working underneath legislation that talks about a competent person, but never really actually defines what that is. The situation when the industry was small was a little intolerable, but now the industry has evolved. We're seeing more and more different asbestos contaminating materials coming into Australia, being used, being removed, being disposed of, and we continue to face asbestos challenges even today. So what happens when competency is poor or incomplete? It doesn't just produce variable outcomes, variable qualities. It actually produces dangerous outcomes. Inaccurate surveys mean that asbestos may be missed, it's undiscovered, it's unmanaged, it's unchecked. Poor removal practices can expose both workers and the public. Laboratory misidentification can undermine decision-making and further decisions moving forward. And poor client communication leaves homeowners, leaves businesses, and leaves the government without the clarity that they deserve. And what happens when competency is not defined? So the work health and safety legislation in Australia, and as FAMANZ also works in New Zealand, it's under the AHCA, the HSWA in New Zealand. They both require competency, but they don't describe what it is, or they don't consistently describe what that is. And this leaves professionals that are uncertain as to whether or not they can do a job, clients that are confused as to who they may be able to rely on, regulators who can't actually enforce the regulations that are there, and we have these real world impacts. So when we look at the asbestos life cycle, competency really is the core principle to protecting people, which is what we are all about. And of course, I think many of us at the moment are absolutely exhausted with Sandgate. So we have an international wake-up call that has come on the heels of others. And whether we work with it, without it, whether our children are with it, whether our friends are with it, without good competency, we can't protect ourselves and we can't protect others. So the impact of asbestos competency has become very, very clear over the past couple of weeks. So many questions have arisen. What is a licensed asbestos assessor? What is a NATA accredited laboratory? Who's responsible for this? What do I do? Where do I start? Who do I call? So we're seeing the impact of asbestos competency in real time, or the lack of it. We're seeing an inconsistent approach taken across jurisdictions and across countries. We're seeing inconsistent approaches being taken by the professionals themselves. And we're seeing an inconsistent approach between workplaces and also between workplaces and homes.
So 2026, the year we fix this. So why now? The industry is ready. We are tired. I think all of us are a bit tired. And more time is spent cleaning up after the aftermath of incompetence or explaining what must actually happen, when or what results actually mean, than doing the job. Regulators have acknowledged the issue, and Safe Work Australia have committed to reviewing the asbestos regulatory framework. WorkSafe New Zealand have recently replaced the asbestos codes of practice with technical guidance. ASSEA has moved to the next phase of the National Asbestos Strategy and delivered the National Guide for Asbestos Surveys. Recent incidents have proved that gaps can cause real harm. There's always difficulty in communicating hazard versus risk, and then also managing risk perception. But truly competent people can effectively communicate the science and need behind an asbestos exposure. Training and professional pathways are needed. And did I mention we were tired? There's not enough of us. Training and experience can be limited. And until there is emergency, not enough people know that there are asbestos careers out there. The sector and the public want clarity, consistency, and confidence. All of the pieces are in place. We have the momentum, we have industry support, and we have multiple national bodies ready to collaborate. So 2026 is the right moment to deliver a unified approach. So where do we start? We have the IP 400 series for Australia and New Zealand. And one of the major pillars of reform is training. So FAMANZ and the British Occupational Hygiene Society have developed the Australian and New Zealand specific IP 400 series modules for surveying, assessment and laboratory analysis. This will continue to hold the reputation of the 400 series offered by the BOHS, but will specifically address the Australian and New Zealand regulatory framework and best practices approach in our region. The updated IPs have been reviewed by industry experts and will be delivered, marked and certified with the BOHS. Another major step forward is the National Memorandum of Understanding between 5 major peak bodies. This partnership recognises that asbestos in soils is one of the fastest growing areas of risk and one of the most inconsistent in practice. By unifying training across contaminated land consultants, hygienists, asbestos consultants and assessors, we are closing one of the biggest competency gaps. And I'll hand back to my friend Jax.
Thank you. And on top of all of that training, we still also have this gap around what a competent person is. So the draft competency framework is that missing piece that industry has been asking for. So for all of our primary occupations in the asbestos industry, we need to establish a framework for that competency, to have it agreed as to what qualifications and what training is required, to understand how many years or how many projects or how many surveys need to be completed to lead to someone through moving those through the steps of developing proficient, competent, and then expert. So the asbestos competency framework defines what competency looks like for each of those occupations and for each of those stages. It also provides a pathway for individuals and companies to train people to understand how much work they need to do, what range of work they might need to do. It sets expectations for both employers and professionals as to what is expected from someone who is competent. It will improve the clarity for regulators to enable them to properly respond and enforce the regulations. It's going to support our training providers, and across the board, it is going to lift the bar for industry. We really want this competency framework to be the backbone of asbestos professionalism in our entire region. So, by the end of 2026, what is success going to look like? How do we evaluate this? So success is going to look like things that we can achieve together and commit to competency reform. So we will have a clear definition of competency for Australia and New Zealand. It can be used cross-purpose, whether or not you want to move from a hazmat technician to a licensed removalist, or if you're a regulator determining if compliance with the laws has actually been achieved. We're going to have harmonised training and qualifications so that all of the jurisdictions across Australia and New Zealand, should they wish to choose to join us, will truly have a mutual recognition of what competency is. And it's going to provide consistency and confidence for the asbestos industry and also enable better cross-border work when it's needed, much like now when we're responding to an emergency. We're going to have agreed pathways for the asbestos profession so that we can have more workers, because this is a rewarding profession and we need more people to move through it. We're going to have stronger regulatory confidence. We're going to have increased competency. We're going to have a very influential, effective regulatory framework that will cover pre-border, post-border, identification, removal and disposal, that entire asbestos life cycle. One of the things we will have if all of these things fall in place is increased professionalism and public trust. The competency will hold us to account and it will build that public trust so that we can truly be relied upon. And of course, in the end, which is what we're all looking for, is reduced exposure risk. Reduced exposure risk will result in reduced incidence of asbestos-related disease, which, as June spoke about, is something we all want to see. Brian.
Oh, okay. So in closing, I'd like to thank you all for having us here today to talk about competence, but I'm going to give a short plug because this is dear to my heart. So please come along and continue the competency conversation at Asbestos 26, which FAMANZ are co-hosting with ASSEA in Sydney in March 2026. At the conference, we have a chance to shape the future of asbestos management, and let's make 2026 the year we finally define, measure and uphold competency across our industry. Thanks very much for listening.
Good. Well, thank you, Brian. Thank you, Jackii. Thank you for a very interesting presentation, particularly with all the things that are happening at the moment. Probably an opportune time to address this matter. Now, first off, just to remind people to put their questions in the chat. Now, we do have some questions, and I'm going to go back. Our first question came from Dylan, and it was really directed at Tracey. So can you pop your screen on there, Tracey? Dylan's question was, are commonly used sampling and analytical methods separate from NIOSH, or do Australian commonly used NIOSH and AHCA methods?
Okay. I'm going to answer Dylan just in the context of the sampling and analysis methods I'm most familiar with. And yes, we have a range of methods, NIOSH, AHCA, and then there are three important Australian standards that apply to measurement of respirable dust, inhalable dust, and asbestos in the bulk form. So yeah, some homegrown and some international. I think the gap I'm pointing out, Dylan, is that many of these methods, particularly the NIOSH ones and the AHCA ones, are quite old. And the last time that they tried to assess the precision or point out the issues with uncertainty is sometimes decades ago. So it is actually quite pleasing that as we speak, there is a refresh of Australian Standard 2985 for respirable dust, and that is expected to be released any minute now. So yeah, so I think that's a really important thing, how frequently that those standards are refreshed, and because we do rely on them to some extent, local and overseas standards.
Thank you, Tracey. Could I ask a question too? What will be the relevance of the action level of 50% of the OEL as it used to be, or the exposure standard, whatever the terminology used? But we used to operate to 50%, but now with the levels going so low, you're in the sort of the level of detection limit now.
Yeah.
Where do hygienists going to go to? What's your
view?
View?
That is a great question. There are several issues that need to be resolved with the introduction of considerably lower occupational exposure limits like the wells. It's not that we shouldn't have been looking at this all along. We probably always should have been looking at the logic behind something like a 50% action level, where it might trigger respiratory protection, or it might even trigger recommendations for health monitoring. So certainly the devil is in the detail here, and the Safe Work Australia well guidance has to treat the requirement for an action level, particularly where some of the substances, not all, but some of the substances are essentially based on no observable adverse effect concentrations. If we were to trigger health monitoring, what would we be looking for? So yeah, that's a definite a rethink. I'm going to say is required on that exact topic.
Good. Thank you, Tracey. Good answer. Now, a second question is from Brody, and it's for Georgia. Similar to the cost-benefit analysis conducted for proactive removal, has analyses been conducted on ongoing management strategies implemented? Let me just pull this out. Implemented by government agencies. For example, conducting presumptive surveys for ongoing management versus bulk sample analyses.
Look, if I've understood the question correctly, I think what you're asking is essentially what the cost is of maintaining the status quo. So although we didn't quantify that in dollar terms, what you saw with our socioeconomic evaluation was the additional costs required to increase the rate of proactive asbestos removal through improved regulatory practices or improved regulatory practices with incentives added on top. And although there are additional costs in doing that in the long term or in undertaking in spending that money, there are additional benefits that far outweigh any of the costs. So, for example, maintaining an asbestos register because you have ACMs in situ that has continued to be managed is an ongoing cost. Removing those asbestos-containing materials, although there might be an additional cost imposed at the time, the benefits long-term far outweigh that. So you get a return on investment, as I said, of between $2 and $3 for every dollar invested in proactive asbestos removal. So I hope I've understood the question correctly. So the current status quo is essentially in situ asbestos management, which is what is the majority of what's being done at the moment, and we need to really shift the gears and follow the hierarchy of controls and move towards elimination and therefore removal of asbestos containing materials.
Okay, Georgia, could I ask you a question? Thank you for that. But a question I had going through my mind is, well, we know there's a lot of AC sheeting about, and we saw the pictures of June where it's used in fencing in WA, and it's used widely in roofing and all sorts of outbuildings. And then the other, I presume another big use is lagging in infrastructure type situations. So with your review that you're doing, the 2030 blueprint, do you sort of see that in the easy wins are going to be things like AC sheeting in certain applications? So do you sort of see that, with your 2030 blueprint that we're going to see active removal of AC sheeting, and then certainly next probably the asbestos used in lagging in infrastructure?
Look, absolutely. We need to prioritise any removal that we undertake, and AC sheeting in terms of its application in terms of roofing and fencing, for example, we consider that, or we know it's the highest risk in terms of potential exposure for humans. So yes, ideally the shift towards an increased rate of asbestos removal will be a prioritised approach, and highest risk asbestos products need to be removed first, and that's how we envisage that playing out.
Do you see that being legislated? Will that be a requirement for people to do that? How do you see applying your blueprint for removal?
Yeah, look, there won't be strict legislation in terms of you must remove your asbestos roof. The way that we've mapped it out in the Asbestos National Strategic Plan is improvement in frameworks that will allow for asbestos removal to occur in an easier and safer way, that there's enough professionals out there to allow us to identify the asbestos, have it removed professionally, disposed appropriately, and the like. So it's really about increasing or improving the frameworks we have in place, and adding additional incentives on top of that. Once we've got the improved frameworks in place, overlaying that with additional incentives to change behaviours and promote that removal.
Excellent. Thank you. Thank you. Our next question is from Aidan. It's for John Batty. What is the approach in noting that a part of a building has been remediated and restored? In considering the age of a building and seeing the building components that appear similar to ACM, like the train station awning from the case study, how would this be made clear that it's remediated part of the building rather than an unidentified ACM not included in the asbestos register?
That's awesome. Thank you, Aidan, for your question. I think it comes back to documenting everything, really needing to document not only where the asbestos has been identified, but also when the asbestos has been removed. So really you should have an asbestos register or a hazardous materials register that goes through the whole life cycle of that register, from identification and maintaining that item within the register and making a note that it has been removed. So when someone comes along in the future, obviously they're reviewing the register up front, they can see that there was an asbestos warning there previously that has been removed. It was removed on this specific date by this specific team, and there's nothing remaining in the area, or potentially there may still be asbestos stuck in the rafters, for instance, that they need to be aware of. So really it is just documenting it and ensuring that that is kept in, for the life of the building, really. That answers it.
Good. Thank you. Thanks, John. We have another question from Lee. My apologies, Lee. The UK are struggling with quality, even with analysts, hygienists and surveys. Whom have BOHS qualifications competency? It's got very diluted over the years. Can this outcome be avoided over here, do you think? So you're going to do better than BOHS there. This is for Brian and Jackii. So the question for you is, are you going to deliver better than BOHS?
Well, the quality of training in the asbestos field has been an issue for quite some time, and that was one of the things that we've spent quite some time in talking through with both the ASSEA and the BOHS to ensure that the quality of the training and the level that would be expected is actually in place. So in developing the course, obviously the thing that's come through is that preferences for face-to-face training. For the theory, certainly where practical, and obviously to achieve the required hours of training. But obviously we're got long distances, obviously here in Australia and similarly in New Zealand, there will be a process for that to be virtual on, but the formal practical will be face-to-face. And so there will be locations established for the formal practical. And I guess that was one of the key things that ASSEA was looking for, that people who were actually doing surveys actually knew how to sample materials, what to assess, what to look for, and to do it safely. So that's been a key thing. We have called out for an expression of interest for trainers, and that evaluation is going through now. And the trainers will be approved both by FAMANZ and BOHS. And what we are looking for is for Cert 4 trainers from the Australian context and similar in New Zealand. So we have that level of competency in the training people. The programs will be audited. So there will be an auditor appointed to assess the courses as they move forward. And that's really just trying to make sure that we've got the right level of standard of competency in there. Now, does that answer the question? All we can do is hope that we put enough checks and balances in there, because we know, and the question was quite right, one of the issues we know with the BHS that there are issues with what's been happening in the UK recently, and they're actually taking some of the things we've suggested into their program. So early next year, we should be launching all over the place with our new trainers, and we will see from there. And I'll look forward to feedback from people when they are going through the program to let us know whether we're on the mark or whether we've missed, or whether we're too stringent or whatever. I'd also like to add that the draft competency framework that Jackii spoke about is available for public comment, so you can get that from the FAMANZ website. And the BOHS has also been included in that for their framework, as they're going through their competency framework development at the same time. Did you have anything else to add, Jax?
Okay, actually, well, I'd like to ask a question there, Brian, about that. You talked about your working with a team of other organisations like the AIOH and AHCA. I mean, if you're going to be running these extensive training programs, does that mean you would be looking for those organisations as being approved training providers and being able to run those IP training courses that you're referring to?
Anyone can apply to be a trainer for these courses, but they do have to be a member of FAMANZ.
Okay. Well, thank you for that clarification.
And that's part of the agreement with the BOHS. So there you go. And that's not very hard. Doesn't cost very much to be a member.
Okay, but you'll have exams, I presume, and therefore will you be charged by FAMANZ for the exams?
Yeah, the whole process is will be online registration and administered here in Australia, but linking directly to BOHS in the UK.
Oh, doing BOHS exams.
It's BOHS are administering the exams, but the exams are FAMANZ, Australian New Zealand based exams. So all the examinations and everything have been written for the Australian New Zealand environment, and all the BOHS are doing is the back end, which is the data processing and issuing certificates at the present time.
Okay, good. Thank you for that. Now, John, you can direct your question to Georgia. I can see you're listed here as the next question. Would you like to?
Thank you, Sharon. Let me get Georgia on the screen. Georgia, with your the modelling that you've undertaken, just getting an understanding of, you've got those two end dates where the options come to a conclusion. When do you have to start? What date are you looking at to put those options into place?
The modelling was based on a 5-year time frame from the commencement of those options being put in place. So roughly in line with the third phase asbestos national strategic plan.
Mm-hmm.
So by the time we hit 2030, we want to be in a position where we are ready to go in terms of the regulatory framework has been improved, and we're in a position for incentives to commence to be offered. So that's that's how the modelling's been designed.
Okay, great. And have you seen appetite from the Commonwealth and state governments around these options that we're looking at the moment?
There's certainly interest in understanding more the background sort of research that we've done, and the report that I referred to was released earlier this year. So there's definitely interest in understanding the research that we've done, that we undertook, and how that can be used in place. So yeah, it is about, I guess, lobbying, everyone lobbying to make these things happen.
Fantastic. Thank you. Back to you, Sharon.
Good. Thank you. Good. Thank you, Georgia. The next question is from Peter. Let me just open this up, please. Peter has asked, in your opinion, and in an ideal world, what would be the definition of a competent person be? What would you like the regulators to acknowledge and regulate? And what sort of language is needed to increase the clarity of these definitions for the client? Sorry, over to you, Jackii.
Thanks, Sharon. In an ideal world, I think the definition of competent person is a mixture of things. And I think it also depends on your occupation, but really it's around your knowledge and your qualifications. It's around your skills and what you can do and how you can do it and how well you can do it. It's around your training profile. So we all know that your theory's there, but your practical is really important. But in the asbestos industry, particularly with different occupations, it's also about like how much stuff you get done and how long it takes you to do it. So it's that mixture of all of those things. And, you know, if we think about licensed asbestos assessors, to make sure that they do have a broad range of experience. In occupational hygiene, as Sharon, you know, we specialise in, you know, particular things, but we've got to have that broad knowledge of everything so that when those questions come up, you at least have that scientific thinking and that way of approaching to get things. But you've also got those people in your back pocket that you can just ring up and go, oh my God, what do I do? So I think competent person is a mixture of things, and you can describe it. You're always going to have exceptions to the rule. You're always going to have amazing people who are going to fly through, but setting those expectations is really, really important. And I think for regulators as well, for them to go, okay, we've got this person with a licensed asbestos assessor license who's never done a survey and he's on a survey site trying to update a register. Really being able to have that down for a regulator to go, no, maybe you're actually not the right person to do that. And you can do that for removalists as well. And in the lab as well, you can apply all of those things. And I think once we've got that down pat, if a client rings up and says, I need this, you know, you've got someone there and go, great, I've got Sharon over here. She's got 10 years experience. She's done surveys on tier 1, tier 2 in residential. She's got all of her ID in the lab and her fibre counts. She's the person for you. And to be able to give that to a client, to give them that sort of confidence that I'm sending Sharon and she's going to set you right is exactly where we want to go.
Thank you, Jackii. Actually, Jackii, we just, I've got a couple more here, and you can answer the next one. This is from Jason. Jason, he's asked, Brian or Jackii, was an apprenticeship model considered for asbestos removalists and consultants? Would you bring together textbooks and experience?
Yes. So as I just said, absolutely. It's that big mix of having that theoretical side, because there is a lot of technical stuff in the asbestos industry. No matter who you are, there's really technical stuff. You've got to have that theory, but then working on it and practicing it and having mentors in the field and supervisors with you who can go, that's not quite how we do that. Let's, try that again. To sample, today, for example, I was out sampling vermiculite, which is very different to sampling a piece of asbestos roofing. To have that with someone with you to go, okay, here are the steps you need to do. So that apprenticeship model, or that development through your developing to proficient to competent to experts, really, really important. And particularly when we've got, as we all know as well, we've got a lot of sole traders in this industry, to be able to give them someone that they can learn from as well is really, really important.
So does that mean we're going to see certified asbestos assessors, are certified like a CAA?
It could possibly. It's, one of the things with this framework, some of the feedback we're trying to get, as we mentioned, Safe Work Australia are looking at the entire asbestos framework. Any of the information that we can get from the industry around competency about whether it needs to be certified. Some of the dilution I think that's occurred in the UK with that question previously has been, all of this training is you do it once and you're done for a lifetime. As we all know, everything can change in 6 months. So is it also about having that continual professional development? Is it having those refresher courses? Is it making sure that you're keeping up to date and how that can be done? I think that's really important as well.
Good. Thank you, Jackii. We have a last question from Kim saying, will people who have been doing asbestos assessments, monitoring, etc., for more than 10 years, will they be grandfathered, or do they still need to go through this competency framework system?
I'm leaving that for you, Brian.
No, well, the framework is going to set the standards or requirements for the levels within that framework. And if you've got 10 years experience, I would expect that you're able to demonstrate that you're competent in those areas, and that would be not so much grandfather, but your experience and your knowledge would automatically put you into that level, which is where it should be. I think that's probably where it is. I think with all of that, Jax. The other thing I should add about the UK asbestos thing is that the British Faculty of Asbestos Management, FAM, doesn't embrace anyone outside of the asbestos hygienists, so that they're actually not talking directly to removalists, they're not talking directly to analysts. And I think one of the things we do very well in Australia and New Zealand is that the asbestos hygienists, if you want to call them that, the hygienists, the laboratory people and the asbestos removalists, in most instances have a fairly good relationship. At least you can talk to each other and there's no barriers. And what we would like to see is ultimately everyone being able to talk to each other and actually raise the bar in all areas, because I'm sure there's things both ways that, removalists would like to see hygienists do better and hygienists would like to see lab people do better. And, that's where we're aiming. That's where we want to be. And that raises the whole area of expertise.
That's excellent. It's a great point to bring to this webinar to a close. So thank you, Brian. Thank you, Jackii. So I'm going to wrap up now. We've just come in nearly for time. So a couple of things. Firstly, I would really like to say thank you to Jason Adams and the Blue Mountain City Council for hosting this webinar. We're really quite indebted, and I know Jason spent a lot of time supporting us and looking after making this such a great success story. And I'd particularly like to have a big thank you to all of our guest speakers today. They are excellent presentations. and covered such a variety of different issues about the wonderful word asbestos, which we all live with. It was fantastic the way it actually went from a whole spectrum, with June starting off with Widnum and the whole start of the story of asbestos in Australia, and we went right through the whole control side, really all about protecting the health of workers and the community. So I thought it was an excellent range of speakers, which when John and I started this several months ago, we didn't realise it'd take to such a fantastic session. There will be links for this webinar on the AIOH and AHCA website, which you're most welcome to use. And I think I'm going to draw it to a close. And thank you all very much, all those people who participated both as speakers and online. So thank you.